Hello there. Welcome back to another topic on Ask Dr. Ted. Last time we talked about fever, and there was one thing I forgot to mention that is very important. You do not want to give ibuprofen, Advil, or Motrin liquid to infants less than 6 months old. There's some issues with the heart and different things. It's not anything we'll go into detail on, but Tylenol for 6 months and older, ibuprofen 6 months and older. And again, you can talk with your doctor about these kind of things. Today, somebody actually asked us a question, a very good question, especially this time of the year, winter. They said, how do you know when a rash that you get is worrisome, especially in children, right? Children get way more rashes than adults do. They get more viral infections, they get more illnesses. When you study pediatrics, boy, you start with infectious disease, and that's a lot of pediatrics is the various infectious illnesses they can get, viruses, bacteria, different things. So I thought that was a really good topic to discuss. So the first thing let's talk about is things that you don't need to worry about. If you have things like this, and I just put some notes here. If you see me looking down, I got some notes. One is your child has an illness, a cold, right? They have a cold. They've got a runny nose. They're coughing, maybe a little bit of a fever like we talked about. We're not worried about fever. Fever is just a symptom. We treat it because it makes the kid feel better. But they get a rash with their illness. That's actually, a good sign that it may not be anything to worry about. It blanches with pressure. Like if you take and you push on it, it turns white, and then you let go and it turns pink again. The worrisome rashes, they don't turn white, and we'll go into that more detail. An itchy rash, one that itches. That's a good sign. The scary things do not itch. They cause, generally, never say never, but itchy is a good sign. It's not painful. Rashes that are painful are more worrisome. Rashes that are not painful, not as worrisome. Here's a very good one. The kid does not look sick. The kid actually looks pretty good. They may have a fever and you give them some Tylenol or some ibuprofen and they feel better, but the kid looks good. They're still eating and drinking and they don't look really out of it or sick. Kid looks good. Another good sign, it does not involve the eyes. It does not involve the inside of the mouth, the tongue and the lips. The lips is a big one. It does not involve the hands or the soles of your feet. It does not involve the joints. Generally, if you have a rash that gets in your eyes, makes red eyes, red mucosal rash that's sore in the mouth and sore eyes and sore swollen lips, sore swollen hands or feet, joint pains in wherever your elbows, your hands, your fingers, your knees. That's something more to keep an eye on. And when you give them some Advil or Motrin or Tylenol, they do feel better. Plus minus fever. You can have a rash that is nothing and have a fever. You can have a rash with no fever that is worrisome. So fever is kind of iffy. Okay, now, more important than what not to worry about, here's something we do need to worry about. If you have a rash that begins when you start a new medication, that's always to be taken serious. You should never continue a medicine. If you start a new medicine, especially prescription medicine, but also over-the-counter, ibuprofen, as much as I say how great it is, ibuprofen can cause rash, and any medicine can cause a rash. Bodies are just different, and somebody may react to something that nobody else reacts to. So if you get a new rash and you start a new medicine, stop that medicine and talk to your doctor, and they'll help you figure it out if it's something you can continue, or maybe it's just a rash that came on coincidentally when you started this new medication. The big ones to worry about: anti-inflammatories, so like ibuprofen, ibuprofen, Advil, Motrin, anti-seizure medicines, antibiotics, antifungal medications, and pretty much any medicine can cause it, but those are some big ones. Sulfa is a real big one, penicillins. If you ever get a rash while you're taking those, just stop taking it and talk to your doctor about it or your provider. Another one, so it starts when you start a medication. The rash starts when you start a medication. Another one is the color. A deep red or purple or black, and I don't think you would need me to tell you that. They just look bad. We like pink. We don't even mind red so much, but deep red, purple, black, that's bad. That's usually tissues are dying in the skin, deeper skin layers. I'll show you some pictures and we'll go into that more detail. Blisters. We don't like blisters. Doesn't mean it's anything worrisome, but usually if it's a blistery rash, probably ought to be seen by your provider, your doctor, physician assistant, nurse practitioner. Somebody should see it. Painful. Painful rashes are not good. Painful rashes where the rash is, or painful in your joints, that's not good. A very severe rash and a headache, a very severe rash and neck pain, a very severe rash and chest pain or abdominal pain, that's not good. Rash with pain is not good. Rash with fever, plus minus. Rash with pain, not good. A rash that does involve your eyes. You get red eyes, pink eye, pink or rash or sores inside your mouth or your tongue or your lips. Hands and feet. If you get a rash that involves your hands and your feet, that's never good. That's always another one. May not be bad, but it's something that I'll be looked at. You don't feel better when you take over-the-counter medications. You take ibuprofen or Tylenol, and it doesn't feel better. That's something that you need to maybe be seen for. Okay, now let me show you some pictures, and we'll give you some ideas of what we're talking about. Here's a rash that you've probably all seen. This is typical hives. And you can see if you were to push on that with your finger, it would turn pink or it would turn white. The pink would turn white. And then when you let it up, it would go back to its normal pink color. And it's itchy, right? Hives itch. That's an allergic reaction or hay fever, allergy of some kind. It's not deep red. It's not purple. It's not black. That one's not as concerning. You can take some over-the-counter medications for hives, and you can treat that. Another one, here's another picture of hives. And look at this picture. There's a sign, itchy. Can you see how that person's scratching it? And look, again, it's pink, not red or purple or black. It's raised. Hives can raise, and they can come and go. I've seen people in the waiting room that have a rash just like this, and by the time we get them back in 5 or 10 minutes, it's gone. The rash is gone. Sorry about the reflection off my phone. The rash is gone. Hives can come and go. That's another sign. And it's itchy, okay? Now, let me show you one that's more worrisome. Okay, if I can get this back. Look at that one. You just know that doesn't look good, right? That's purple, black, deep red. If you pushed on that, it would not turn white. It would not blanch. It would not turn white. That one definitely should be seen by somebody that knows what they're doing. Some doctor, provider, dermatologist, somebody. Urgent care, emergency room. That one should be seen. Again, dark purple, red, doesn't blanch. Okay, here's a good one. Look at this little guy. Does he look like he's sick? No, he's got a rash, but it's pink. If you were to push on any of those, they would turn white, and then it would come back. Look at him. He's smiling. And here's a better picture of his face. Look at his eye. There's no pink in his eyes. There's no pink on his lips. If I can get this, there we are. Look at his lips. They don't look bright and pink and red. His eyes look good. He's got a rash, but it's blanchable. This is called fifth disease. We see this all the time. And you just tell people, give them Tylenol or ibuprofen if they're older than 6 months, and they do great. Give it time. It'll go away. Look at this one. Here's one. Now look at the difference on this one. Look at that kid's eyes. Those are red eyes, pink eye. Look at his hand. It's swollen. It's red. It's a deeper red than the other one. Hands. If it involves your hands, that's not good. Look at that. It involves his feet or that person's feet. Look at that tongue and those lips. Those are very dark red. That's not a pink. That's a deep red. We don't like those. Hands, feet, deep red, purple, black, eyes. We don't like those. You got to be seen. Got to be seen by somebody. Doesn't mean it's anything terrible, but you want to be seen. Look at this kid. Does he look happy? Look at that face. He is not happy. And look, it's involving his lips and his tongue, and he's probably got sores in his mouth. That's not good. Look at those leg rashes. If you push on those, they don't turn white. They're deep red or even kind of purpley looking. We don't like those. You don't like those. That kid needs to be seen, and they'll probably do some blood tests on him. Again, these aren't common things, but we're just teaching you what to look for. There's the rash we were talking about. If you start a new medication, especially an anti-inflammatory over-the-counter like ibuprofen, or an anti-seizure, or an antibiotic medication, or an anti-epileptic, an anti-seizure medicine, I think we said, and you start getting a rash, that's never good. That one, stop the medicine immediately and go see somebody that knows how to treat that. And here's another one that you'll see. Look at this guy. Sore throat right there. I mean, when you get that weird rash, you get a very sore throat because it's involving the mucous membranes of your lips and your throat. That's not a good sign. Not just, not a sore throat with a cold or a flu, something like that. You started a new medicine and now you're getting a terrible sore throat. This one right here, what does that say? Mouth ulcers. We've kind of talked about that one right there. And look at that person's eyes. Again, any rash, I'm sorry about the quality here. I just pulled these off the internet. Look at that person's eyes. Any rash that involves the eyes, you only get 2 eyes. You don't want to mess with those. Those are delicate little cameras. Any rash that involves your eyes like that, you probably want to be seen, okay? And that's all the pictures I have. So now you know the scary things to look for: deep red, deep purple, black, blistery. It involves your eyes, pink eye, and sores in your mouth and on your tongue and on your lips. That's never good. Swollen hands or swollen feet or rash on your hands, rash on your feet. That should be seen. Rash with headache, rash with a neck pain, rash with chest pain or abdominal pain. Those are all things that should be seen. Okay, so now you're kind of a lot more than you did. Hopefully that might save somebody having to go to the ER and lots of time and money. So hopefully that'll help you. We're going to do one. I'm going to do one either tomorrow or the next day. Sore throats that kill. Most sore throats are not worrisome, and everybody knows about strep throat. We'll talk about that. But there's some sore throats you can't miss, and there's very obvious, and we'll talk about that. Sore throats that kill. And then I was thinking there's one I want to do called 10 ways to accidentally hurt or kill your baby or your child. These are things every parent should know. They're common things that you wouldn't even think of. 10 ways to accidentally harm or kill your child or your baby. Every parent should see these and know these, and they're just good things to know. And it's really, medicine's pretty simple. It's just there's so much volume. And most of the time, nobody sits down to talk about it with you like we're doing here. So hopefully this is helping you and you're enjoying it. Okay, everybody have a good one, and we'll see you next time. Thanks for tuning in. Bye-bye.